Events and moments in the mid 1980s to 2000s for AIDS and HIV. In 1981, cases of rare lung infection called PCP were found in 5 previously healthy gay men in LA. The first cases of PCP were reported at the end of 1981, and it was normally found in people who injected drugs. By the end of this year, 270 cases were reported of immune deficient gay men, and 121 of them had died. In March of 1985, the U.S. Food and Drug Administration licensed the first commercial blood test. This blood test was known as ELSA, and it was used to detect antibodies in blood for HIV. Blood banks also started to begin screening the U.S. blood supply. And the first International AIDS Conference was held in Atlanta, Georgia. Rock Hudson became the first high-profile fatality due to HIV, and he left $250,000 to set up the American Foundation for AIDS Research. By the end of this year, 20,303 cases have been reported. In 1990, the International AIDS Conference protested against the USA's immigration policy. In this conference, the protest stopped people with HIV from entering the country. The Americans with Disabilities Act prohibited discrimination to those living with HIV, and over 307,000 cases have been reported by the end of this year. In 1995, the FDA approved the first protease inhibitor, beginning a new era of highly active anti-retrieval treatment, HAART. This had brought about an immediate decline of between 60 to 80% in rates of AIDS-related deaths and hospitalization in countries that were able to afford it. It was estimated that 4.7 million new cases were reported by the end of this year in the entire world. In 2000, UNAIDS negotiated with 5 pharmaceutical companies in order to reduce drug prices in developing countries. The United Nations adopted the Millennium Development Goals. This was a specific goal to reverse the spread of HIV, malaria, and TB.